I'm Dr Manish Bhatia, your friend and guide from drbhatia.com. Today we are going to discuss what is autism. The word autism is derived from a Greek word autos. Autos means self. So autism is a condition in which the person is limited to himself. The person is not able to relate to the world outside, or so it appears. It is a neurodevelopmental disorder which affects the person in multiple levels. The primary areas that get affected: social development, cognitive development, and behavioral patterns are affected. So what we primarily see in autism is that it is unable to relate with others. It appears as if the autistic child is in his or her own world, as if for that autistic child the world outside does not exist. The child is not taking any cues from the social environment and is not responding to the social cues given to it by the parents or the caretakers. Now, the degree of severity may vary. In fact, what we understand as autism today is in fact it's a spectrum. Till DSM-4, it was part of, there were 5 different conditions. One was autism, in which we realize that there is social development is affected, cognitive development is affected, and the patient has special behavioral patterns. Second thing was Asperger's syndrome, in which the symptoms are much milder, the cognitive development is usually not affected, only the social development is primarily affected. Today, what we call this as, often call it as high functioning autism, where the child has, because the cognitive function is normal, the child's mental abilities are good, and in fact sometimes they are better than average people. But still the social interaction remains restricted. Then there were other 2 things like Reed's disorder and childhood disintegrative disorder, in which the children develop normally for a certain period of time, and then they seem to regress, as if they lose their abilities that they have developed for a certain period of time. This regression used to occur between the age of 2 to 10, and today these 2 syndromes are again clubbed in as autism, and they are called regressive autism. So these are the different types of disorders, and then there was another type of disorder called pervasive development disorder, not otherwise specified. All these 5 classes were called pervasive development disorder. It was an umbrella term. Now all these 5 different types of pervasive development disorders are part of the autism spectrum disorder. So what happens when the child becomes autistic, or when the child is labeled as autistic? The primary deficit areas that the parents notice, or the pediatrician notices, or the teacher notices, is that the child is not interacting with other children. The child is not even interacting with the parents as he or she should. The language development is usually delayed in these children, often delayed or absent. So there is a child who is not communicating, the child is not responding to social cues, the child is not showing any needs, the child is not developing language, and the child then later on seems to be lost in his or her own world. And later on the child develops very significant behavioral patterns, like spinning of objects, looking at rotating objects, switching on and off the buttons, toe walking, hand flapping, and lining different objects in a particular way. So they develop different what we call tics and behavioral patterns, and this group of symptoms where the child is socially not interacting with others, child is not responding emotionally, the child sometimes is not even able to bond emotionally to the parents, like the child is not able to do meaningful play with other children. The child prefers to sit alone with his toys or in a corner doing nothing. But again, that is one extreme. As I said, autism is a spectrum disorder. There will be other autistic children who are relatively normal emotionally and socially, but the language development is delayed. Some other children are born with other conditions, like autism children, they sometimes are born with mental retardation also. They are autistic children who are suffering from epilepsy. They are autistic children who suffer from gastrointestinal disorders. So again, there are no two autistic children who are alike. There are children with different symptoms, with different degrees of symptoms, but there is a common denominator, and the denominator is that in majority of cases, the ability to perceive social cues, to have a meaningful social life and social interaction with family, with peers, with friends, and with society is significantly lacking. And at the same time, there are special behavioral patterns in different degrees, in varying degrees, present in most of these children, and the language development is usually delayed and restricted. So this, my friends, describes the autism spectrum disorder in very brief. In our next videos, we will cover this spectrum disorder in far more detail. We will be discussing when you should be concerned about your child, whether your child is autistic or not, when you should be going to the GP or the pediatrician to have an opinion about your child's development. We'll be covering all these different topics in the future videos. So stay tuned. Please do subscribe to our YouTube channel, and so that you remain updated with all the latest videos. And make sure, if you have any questions regarding the treatment of your child, regarding autism, your diagnosis, treatment options, what homeopathy can do for you, what other therapies can do for you, visit drbhatia.com, and you can send me a questionnaire. I'll be happy to respond to your queries and be of any assistance that I can provide. Thank you.